Okay. Hello, everybody. We want to make sure that you can hear us okay. So if somebody can do a thumbs up just to make sure you can hear us. Susan, that's a perfect. Great. Got some thumbs up. Excellent. Thank you all for joining us. It's 12 o'clock. We will give folks maybe one more minute to join. Susan, just let me know how many people you see at your end. We expect a good crowd. About 50 people have registered for this, but as life is, there are competing demands. So some individuals will be looking at the recording. With that said, this session will be recorded so that you will have it to refer back to. And okay, let me go ahead and get us started with a quick introduction. Good afternoon, everyone. My name is Yumati Reese. I am an associate professor in the Department of Public Health. This session, this brown bag session, is being hosted by the Center for Rural and Migrant Health. And in that capacity, the hat that I wear is the Center Associate Director. The center's director is Randy Hubach, which unfortunately cannot be with us, but will be joining us a bit later, and Cody Mullen, who is also a Center Associate Director. A little bit about the center itself. Really, our goal is threefold. Our goal is focused on these two areas of rural and migrant health. My area of expertise is looking at how risk and resilience factors influence the lives of rural youth in particular, but families as well. In addition, I also look at mobility and how mobility impacts health. And in that framework, I do look at homelessness because of the transient nature of many of the families. So how does mobility impact health outcomes, but also how does mobility impact resilience to overcome adversity or adverse events in life? So the center is three cores. We conduct research that really is trying to identify issues and implement solutions to address rural health and rural health care. We also work with an array of community partners in terms of evaluation and technical assistance, really trying to determine what and in what ways we can impact policy, project, or program or system, and also capacity development or capacity building, working with organizations to enhance workforce development. For instance, one aspect of our work is trying to think about how one of the mechanisms that could actually be utilized to address some of the issues that emerge in our rural communities is the use of community health workforce. So with that said, in terms of our center, I also wanted to stop and just say that these brown bag sessions are monthly. So please keep an eye out for our upcoming monthly sessions, but they would not be possible without the coordination and the work of our program managers, both Susan Grisham, who is here today, and Lindsay Williams, who is unfortunately unable to make it today due to a personal event. So if Susan, would you mind just quickly introducing yourself?
Yeah, my name is Susan Gresham. I'm program manager here at the Center for Rural and Migrant Health. In my previous life, I was executive director of a youth mentoring program. So I have a passion for community-based organizations and finding ways to connect academia, the research, evaluation, and capacity building that Yumari was talking about, with community-based organizations who have their focus on the ground. So if you have any questions or you have any concerns, or you think there's a way that you could work with within those areas, please contact me, sgresham@purdue.edu.
Thank you so much. So today's event or session will be, I'm going to be introducing Jennifer Layton, and then we're going to open up. She's going to be talking about the immense, powerful work that LTHC is doing, both in urban communities, but their reach for rural communities and how those efforts have. She's also going to be touching on partnerships that she has with community-based organizations as well as universities to try to make those efforts possible, but thinking about how we can continue to expand those efforts and those partnerships so that we can make a better impact or a greater impact on the work that LTHC is trying to carry out. These brown bag sessions truly are, the goal of this is to bring together faculty, students, community, stakeholders together so that we can discuss these critical issues that we are keenly interested in and think about not only how this can inform the work that we're doing, but how can we continue to broaden our reach through partnerships. So with that said, let me introduce Jennifer Layton, who's worked for LTHC Homeless Services, which was formerly known as Lafayette Transitional Housing Center, but she has worked with them for over 30 years. Now, she began her tenure after graduating from Ball State University with a Bachelor of Science degree, and she majored in public relations. Jennifer has truly been and experienced every aspect of what it is to be engaged in this work. She started as a case manager at LTHC, thinking about the job that would be relatively simple. Hey, let me help homeless families sort of navigate through and get them to housing. But what began as a job then quickly turned into a true lifelong passion. So she has been the executive director, and now she's the president and CEO of LTHC, which has overseen significant growth in the ongoing effort to meet the challenging needs of the homeless population. LTHC is known as a one-stop shop. It really does. It is a coordinated entry point. It offers a number of different programs such as day resource center, a night shelter, interim housing, health and wellness, permanent supporting housing, rapid rehousing, and supportive services for veteran families. However, given that this is a coordinated entry point, their reach is immense. So they work with a number of organizations currently to ensure that people are plugged into the services that are available throughout the community. So with that said, I want to encourage you all to please write any questions that you have or comments in the chat. We're going to have Jennifer speak to us, and then we're going to have some time at the end for questions and answers, at least 15-20 minutes towards the end, just to really address any of those questions and or comments that you would like to share with the group. Without further ado, Jennifer, thank you so much for giving us your time today. Very much looking forward to hearing your discussion.
Well, thank you so much. And for the introduction, I do shudder sometimes when I'm reminded about just exactly how long I've worked here. I was 12 for any of you that are math majors when I started. But I continue to be committed to the work. I am passionate about helping people that are unhoused. And so that's why I'm still here. So today I'm really just going to start at the beginning, tell you a little bit about who we are, what we do, kind of dive into a little bit of the programs, both at the urban setting and the rural, and we'll go from there. So we are an agency, a local agency here at LTHC that provides resources, services, and really critical life connections for people that are unhoused in our community. And so that's really what we do, is that we work with the people that are experiencing homelessness, whether they're families, whether they're individuals, they could be veterans, senior citizens, we don't care who you are. The eligibility criteria in order to utilize our services is that you literally have no housing. That's the bar. So for us, we do currently receive funding through the Department of Housing and Urban Development, which we'll get into that towards the end. But there are specific definitions for who exactly are people that are experiencing homelessness. And many times we'll have people that'll call that are living in perhaps a doubled up situation where families that are staying with other families, that happens a lot, where people just can't afford housing. And so they're going to stay with friends or family while they try to secure a new housing service. And they are not eligible for our program because they're still sheltered. They're with someone else, even though the lease isn't in their name. So when I talk about who we are, what we do, it's very clear that we're talking about people that literally have no place to live. So these are people that are staying in shelters. These are people that are staying in their car. people that are sleeping outside or in other places that are really not meant for human habitation. We have a lot of folks that sleep in like abandoned garages or out buildings on people's properties. They don't have electricity really or running water. So those would qualify if they don't have an HVAC system, that sort of thing. So what we do here is we help people in a variety of ways. And the number one thing we do is that we assess folks. We find out who they are, what they've got going on. We really think about what the barriers they have to housing are. And I'll tell you, I get a lot of people that'll ask me all the time, like, why do we have so many people? Like, what's happening? And I'll tell you the number one reason why we have people who are experiencing homelessness is because they can't afford housing. That's the answer. There's not enough affordable housing. I don't know how many of you on this call have to pay for housing, but I'm assuming several of you do. And so you all know the cost of housing. And certainly we've seen in the last couple of years that that's only increased. And so, which is really pricing out people that perhaps don't have sufficient income. Maybe they don't have sufficient income supports. Maybe they are employed, but not at a level that is creating self-sufficiency. Or if it's a family and they're trying to get housing, just the rents are just too high for people that don't have sufficient income. So it's horrible. Like really what we've seen in the last couple of years has just really shown us what's happening as far as the inaffordability for human beings, that they simply can't sustain housing. And so much so that the last couple of years, we've noticed a pretty dramatic growth of our senior citizens. And these are folks that are usually on some type of fixed income, and their income isn't raising with everything else in order to sustain housing solutions. So they are losing their housing because they're not able to keep up with the rental payments. So when we're doing an assessment, we're finding out about who they are, what they've got going on with their housing challenge. And then really because of there's so many people that are here. Last week I looked, we had 427 people that were experiencing homelessness right now. And so because of the amount of people, we have to prioritize people based on what we call their vulnerability. And so we're looking at things like, what are the barriers to their housing success? What is their income? What is their housing history? Do they have multiple evictions? What does their healthcare look like? Do they have any chronic health challenges? Do they have any trouble with any substance use disorder? Do they have any mental health issues going on? That we really try to look at all the things and all the barriers. And then from there, we create what's called a prioritized list. And so based on the vulnerabilities that people have, that's how people are sort of chosen for housing programs that we do. So I'll jump into what those programs are in a few minutes. So while people are waiting for housing, so I had an email just last week from a partner in an assisted living program here in Lafayette that they were getting ready to discharge someone. And so she said, listen, she doesn't have housing. And so we're going to send her over and, tag you're it was really the thing. And I said, well, that's unfortunate that you don't have housing because neither do we. Like I've got over 400 people on a waiting list. It's not like we just have places. And so people have to then manage their homelessness. They're stuck in this traumatic event of not having housing and having to navigate a system that we do our best, but we don't get any state or federal funds to do emergency shelter. And so it's very, it's difficult and it's challenging. Here at LTHC, we run what we call a 24/7 engagement center. It actually opened January 18th of 2020, which would have been 6 weeks before what happened. And so we are very thankful for our facility here and that it allows us to be open for people that don't have housing. So what we do here is multiple programs. We have what's called a day resource center. Here at the Day Resource Center, this is a place that's open from 7 a.m. till 8:30 p.m., 7 days a week. So people can come here and have a safe place to be. And then it also offers supportive services on site, which means people can get meals here. We do breakfast, lunch, and dinner. We have showers, we have laundry, we of course have case managers, we have a computer lab, we have all the necessary hygiene products. We're constantly giving out socks, sometimes even underwear if we have them. And we're here to just support people while they don't have housing. On the back side of the building, opening at 8:30 p.m., we have our emergency shelter. Now, what we do is we call it an overflow shelter. We partner very closely with Lafayette Urban Ministry, which is our local emergency shelter here in Lafayette. And so they provide our community's response for individuals that are experiencing homelessness, but they have 48 beds. During the winter, from November to March, they open an overflow winter contingency shelter. And so they open up some office space and they have mats available for an additional around 40 human beings so that we've got places for them. So here at LTHC, we open up what's called the overflow shelter. And so during the year, we have 10 beds. During the winter, we have 18 beds. And that's for people who are not able to access LUM. Perhaps they, LUM does have some criteria for eligibility. And so if people maybe have timed out of LUM, or if they have criminality that doesn't allow them to go to LUM, or maybe they don't have an identification that's appropriate, whatever the case may be. So we have 18 emergency housing beds, emergency shelter beds that are here at LTHC, and those are on a night-by-night basis. We also have 13 beds that's called our interim housing program. And so here now, again, this is all on the first floor, the 24/7 engagement center. The interim housing program is sort of a conduit between an emergency shelter placement and a housing placement. So this is for people that we know have a housing solution that's upcoming. So maybe it's the end of February right now. So maybe we have somebody that mid-March, on March 15th, their unit will be ready. They will be able to get into and secure a housing solution. So now they're going to be eligible for the interim housing program. People can be in that program for up to 90 days. We also have a program called Medical Respite, where we have 4 pods, beds, that are available for people that perhaps have some kind of medical necessity where they need access 24/7 to a bed. Many times this is available to people, perhaps they had a medical procedure, maybe they're recovering from something's happening where they just need a place to be. We are not a skilled or assisted living facility. We don't provide hands-on care. I don't hire or employ any nursing staff. So this is where people have to be able to do their own thing, but we at least have a shelter bed available to them 24/7. So if they need to rest during the day, they have access to that. So all in all, we every day here serve around 100 people throughout the day here at the Day Resource Center and at the overnight shelter. One of the things I wanted to touch on was partnerships. And so I did talk about LUM a little bit, but there's also 2 other emergency shelters in our community. One is called the Greater Lafayette Family Shelter. It used to be known as Family Promise of Greater Lafayette. And so we do a coordinated entry for all the families that are coming in. And again, there's room for 5 families at that shelter. They are almost always at capacity. And only families that literally have nowhere else to go are those that qualify for the shelter. Another partner is through the YWCA, the Domestic Violence Shelter. We have way too many people that are living in violent situations. The YWCA does a great job in providing a safe place for survivors to go. But again, it takes a long time to get out of shelter to seek a permanent housing solution when they're fleeing domestic violence. So those are the really committed partnerships that we have that specifically for those in the Tippecanoe County area that are experiencing homelessness. So what do? So when people come in and we're prioritizing people for programs, we have several different types of programs that people could be eligible. So our first program is called Permanent Supportive Housing. And so this is actually a housing program that LTHC owns and operates. We have 99 units of housing that we are the leaseholder, like people can lease from us. And so we have 11 units for families. The rest of the units are for single individuals. But in order to qualify, people have to have very high barriers to their housing in order to be eligible. So not only do you have to be experiencing homelessness, but because there's so many people that are experiencing homelessness, you have to be experiencing homelessness for the longest amount of time. You have to usually have a disabling condition of some kind, multiple evictions, like people that have a lot of things. They can never find a private landlord that would provide them with an opportunity. So then they live with us. So the supportive housing projects are really here for two parts. They're here to provide a housing opportunity, because nobody does well when they don't have housing. So we provide housing, but then we also provide supportive services. So we have partnerships with Valley Oaks, which is our community mental health center, where they have life skills trainer, case managers that will come in and work with people and help them sustain their housing. If there's an issue with budgeting, if there's an issue with mental health care, if there's an issue with substance use disorder, if there's an issue with cleanliness, whatever the issues are, Valley Oaks can come in and help provide the tenant with some guidance and some expertise, education, to get them where they need to be in order to sustain housing. So permanent supportive housing is really one of those things where people can live there forever. That's not our goal or intention. Our hope is that we can help people connect to the care they need, get them the income supports that they need, so that eventually they'll be able to go out in the community and live on their own. Sometimes it works, sometimes it doesn't. Sometimes people will live with us forever, just due to the nature of their disabling conditions. And that's okay too. For people that have some barriers to housing, maybe they have some evictions, maybe they owe a couple of landlords, they've got some income, but not enough to sustain housing. We have a program called Rapid Rehousing. Now, Rapid Rehousing is a program where we partner with local landlords. So the landlords have units of housing. We have federally subsidized rental assistance. So we pay rent and we connect the tenants to the landlords and our partnership financially. So we do this for families. We have this for single individuals, and we have a program that's specifically for veterans. And so this is a way that we believe that we can quickly end someone's homelessness is by getting them back into housing. Let's get you back into housing, connect you to services, connect you to care, but ultimately this is a temporary rental assistance program. So for a couple of months, maybe 3, maybe 6, we will help you sustain rent while you're working on connecting whatever dots you need. And that way we walk away and you can fly on your own. So that's the Rapid Rehousing program. So I know that was a lot of information, but we've been around since 1989. And we've continued to grow and expand our programs to help meet the needs of people that are unhoused in our community. And one of the things that had always been an issue is that we had folks that were in the rural communities, the rural counties, that weren't getting access to housing resources. I did see my friend Catherine J is on this call. I'm going to call out Monticello, White County. My parents actually lived in Monticello. And so I was very familiar with Monticello, the services that they had, the resources that they had, and the fact that they also had people that were experiencing homelessness in their county. But they don't have the resources, the capacity, the services to make those kinds of connections for people in order to stay in their own counties. So for years, this has been on the radar that we really needed to do something to try to help the people in the counties surrounding Tippecanoe that were becoming homeless in their counties. How do we help them stay in their community? There's more to it than just housing. When you live somewhere, you build supports. You have a safety net. You have your kids are in school. You have your job. You have, whatever the case may be, but you've built your own community in those counties. And when people are losing their housing, they have to change everything. They would have to change and come to a different county and community in order to get some basic needs met. So providing resources, specific dedicated resources for the county folks had been on my radar for years, just for years. So in 2022, the Department of Housing and Urban Development asked for communities across the country to submit proposals about helping people in rural counties that were experiencing homelessness. So I threw my hat in the ring. I thought, all right, let's see. I don't know. We were awarded funding. We were one of 3 entities in the state of Indiana. The other 2 were awarded funds to help with an unsheltered count, but we were the only rural counties that were awarded. And so we then, in October of 2023, started our rural program. At that time, October 1st of 2023, before we started, one of the things that we did was engage with our rural communities and the partnerships that were already there. Because here's something I want to make sure we know. We are only the housing people. Like, that's the only thing I want to be good at. I want to make sure that we always lean on our partners, that it's more than just a letter of support. Like, we need partners to do the work that they're doing, and we'll be the housing people and have them do the piece that they have. And so we did a lot of prep work before we actually implemented the program. And that was really making sure that there was a need, which we already knew, but we needed the partners to say that there was a need. And then we needed partners to say, we'll help you. Like, how can we help you? Like, this is what we do, and what do you do? And how does that work? So in October of 2023, our project began. Now, when I say project, this means that we've hired staff that are housing stabilization coordinators. And so these folks are deployed in the 7 surrounding counties around Tippecanoe. So it's Benton, Clinton, Carroll, Fountain, Montgomery, Warren, and White. Carroll, Fountain, Warren, White. Yes, 7. And so those are the counties where we're providing service. And so we hired staff to do this work. And then when I wrote the grant, my goal was to provide 30 households a year with service, with assistance. Like, how can we help? Like, let's shoot, who knows? How many? Who knows? So far, now again, this is from October 1st of 2023. So a little over a year and a half now-ish, almost. We've served 104 households. So yay, but not yay. Like, that just shows how many people need the help. So what we needed to do is we needed to not only embed in the communities, but we needed to understand who were the community partners, because this is a rapid rehousing program where we use landlord partnerships. There's a way to end homelessness, and that's with housing. And so we brought a program that had people that have money for rental assistance, but I don't have housing. And so we really needed to do, and we continue to do, this is a huge thing that we do, is to create additional landlord partnerships, because we know what ends homelessness, and that's housing. And so if I'm not building housing, I'm not creating housing, I'm using housing units that are already in these communities, making sure that we have rental assistance, and then we're paying the deposits, first month's rent, maybe 3 months of rent, who knows? But we're helping families and individuals get into housing, and then connecting them to services and resources so that they can sustain that housing. But again, this is a rental assistance project. So this is a temporary, it's not forever. We're trying to make a bridge to bridge people to other resources. So that's what we do for the rural communities. Now, we believe that housing is healthcare. When people don't have housing, we see what happens to human beings that don't have a place to live. Their physical health deteriorates, their mental health deteriorates, their substance use exacerbates. Like, it's all the things, because homelessness is a horribly traumatic experience for people. People are struggling now more than ever. More than ever. We're seeing record numbers of people coming into our space. At the same time, we have new administrations both at the state and federal level, that have different opinions on how to help people that are experiencing homelessness. And I am very concerned about the longevity of any of the systems and of any of the solutions that we have in place. Because we certainly have seen that empathy for people that are unhoused is not a priority. So for the state of Indiana, so just here at LTHC, I'll tell you that our budget is around $4 million a year. It's expensive. Housing's expensive. Operating 24/7 is expensive. Just all the things. We receive approximately $2 million in federal funding to operate various programs. So if those funding streams get shut off, which happened last month for a day, that would be catastrophic to the programs that we do. Catastrophic. So if we lean on any of the funding that we get from the state of Indiana, well, that's almost nil because they don't pay for any emergency shelter. We have one program with them that's a 2.5-year program, and we got $190,000 from them. But that's only rental assistance. So, and local funds from the cities, Lafayette, West Lafayette, Tippecanoe County, from their line items. No, we don't get any funding from them either. Now we do get federal funding called Community Development Block Grant Funds, and those are federal funds that get funneled to communities. And so the cities of Lafayette and West Lafayette, through their Community Development Block Grant funding, they do give us some funding. So we get about $30,000 from each one of them. The county, Tippecanoe County, they did get some opioid settlement money. And so again, it's sort of a pass-through, but we do receive some funding through the Tippecanoe opioid settlement funding. We are a United Way entity. We are very appreciative of United Way dollars because that's for partner agencies. And of course, community philanthropy. And so I was very glad to get the invite to come talk to this group today to talk about really what this looks like. Because every day and every time I open up my email, I wonder what today's going to bring. It's sort of like the beginning of COVID again. Like, we don't know what's happening. We don't know. We're very nervous. But I will stand here and tell you, human beings need housing. They need housing. We need to care about people. I appreciate that communities will fund animal shelters. Like, that's a thing, animal shelters where people will pay a lot of money for animals, but yet they're not that excited about human beings. So for the last couple of weeks, I've been working with the state of Indiana. A representative actually presented a bill that was really about criminalizing people that are sleeping outside. And that she believes, and several people actually believed, that if people were in public places, sidewalks, parks, whatever, that they couldn't be experiencing homelessness there. Now, there's no housing and shelters are full. People might choose not to seek shelter. That's their choice. We can't force people into shelter. But they really believed that if people were on public property for more than 24 hours, that the response to that should be that we're arresting them and then telling them where they should go in order to get help. Well, arresting someone is literally just giving them another issue, another barrier to housing success. And usually people know where to go for managing their homelessness, but there's no end to that. Like, so it's a really horrible situation that people are finding themselves in because there's not oh, I just need to go to the free housing program. Oh, well, I just need to go over here and I'm going to get free housing. Like, no, that's not a thing. Like, we don't have that. I need to choose to not be homeless in this park. Oh, well, hell, why didn't you say so? Like, oh, well, then I'll come over here. Like, we don't have those answers. Pardon me, I just said an H word. It's really important for us to understand that human beings need help. They need affordable housing. They need connections to care, and they need community members that care about them. Not judge them. Don't look at them and think, oh, you're choosing this. I had someone tell me that down at the State House too, that oh, well, they just choose to live that way. Yeah, no, nope. And again, I've worked here for a long time. That's not a thing. Now, people might choose to not come into a shelter because this isn't a great environment either. You got over 100 people in the room, 100 different personalities, 100 different scenarios, 100 different things. Not everybody's getting along all the time. You might find it better for your health to not be in this room. That's okay. I get it. If I were lucky enough to have a car and I was experiencing homelessness, I would sleep in my car too. Many people do that. And that's okay. That's good for self-protection. So it's a lot. Like there's a lot going on, but we're very excited about the opportunity to jump into the rural communities. I am very nervous about the longevity of any of these programs, but while we still have funding and the ability and capacity to help end homelessness for our neighbors in these rural communities, we're going to do all we can to make that happen. I know I've talked forever, so I'm taking a breath. I'm going to open it up for questions. Please ask me anything you want. But before I do that, let me just say, we need your help. We, as a homeless system response, we need your help. Come volunteer. There's things you can do. Come serve a meal. Come answer the phones. Come stuff envelopes. Come talk to people. Like there's lots of different things. Donate money. Like I know that people get a little nervous about donating money, but care about them. Housing that ends homelessness is expensive. I need money to pay rent. Like that's what we need. You want to help? Donate money. Donate stuff. We need underwear, boxers. We need hygiene products. Bring in shampoo, conditioner, soap, towels. There's lots and lots of ways to get involved. You can follow us on social media. Our legal name is still Lafayette Transitional Housing Center, but we do business as LTHC Homeless Services. We made that change back in 2015 because I wanted it to be crystal clear who we were and what we did, and we provide homeless services. That's what we do here. People need our help. People need housing, and I'd invite all of you to be part of that solution. Okay, now I'm going to take a breath.
Jennifer, thank you so much. Thank you for all your insights. As I mentioned in the beginning, your passion and commitment to this cause is truly evident, and we appreciate you sharing not only the work that you do, but also your reflections on what is influencing homelessness in our communities, in particular rural communities, what continues to increase these numbers, what are some of the barriers. I did see one hand. I have a couple of questions myself, but I am going to ask everyone else. I believe it was Brianna. Did you have a hand up?
I did. I was going
Perfect.
to ask Jennifer if if money wasn't a problem, if you had all the money in the world, what would you do right now in our community to help end the homeless crisis?
I would build additional apartments. I would build affordable housing because many of the folks that we see do have some income streams, like whatever that looks like. They just don't have enough money to pay the we just had the person coming in. It was $950 for a one-bedroom apartment in a county. And so that's high. People don't have that, not when they get $941 a month. Like that's a little backwards for folks. So I would build housing. And I'll also tell you that in May of 2023, we had additional funding that we were awarded. It was $7 million at that time. That was specifically for us to develop additional affordable housing for people that we serve. And so this is that supportive housing. How can we do this? And so we wanted to be really intentional about the location because we wanted to prioritize senior citizens and veterans, because those are we got a lot of people that need housing, So our senior citizens and our veterans were the two targeted populations for single individuals. And we found a location that was out near like the hospitals, near the Veterans Administration here in Lafayette. And so we thought, you know what, we're going to go out and have a little community conversation, because I know that people get a little nervous when you talk about creating additional housing. So I wanted to get in front of that narrative, that conversation. Again, I've been around a minute, so it's not my first day. But I was actually met with such hatred from members of the surrounding community that it was after an hour of literally people screaming, so much so where they had like spittle coming out of their mouth. We backed away quickly, because I wouldn't want to do that to my tenants. Like, what a terrible way to treat human beings. And it wasn't a shelter. They had all kinds of negative things to say. And that was for housing somebody for an apartment, like that would have been very pretty and like a gazebo. Like, we had all the things, an event, like it'll be fine. But yeah, so I would build housing, Brianna, I would build housing and make sure it was on public transportation, because many of our folks don't have transportation, and make sure it was near amenities that they needed: employment, shopping, groceries, pharmacy, not out in the middle of a cornfield somewhere. So.
Do we have, I know some bigger cities have regulations where apartment complexes are supposed to have certain apartments available that are under a certain price. Do we have anything like that here?
Oh, no, not in Indiana. No, no, no,
Yeah.
no, no. So that has been encouraged, like that we could maybe perhaps when we're encouraging development of housing, that we could do some set asides, is what they call that, and encourage investors. Maybe they get a tax break if they set aside a certain number of units based on income eligibility. But no, we don't really have that yet, unless they get some specific funding streams that makes them do that. Like if they're getting a low-income housing tax credit project. But people, honestly, they just choose to not do that because they can make money
Mhm.
the old-fashioned way. You know what I mean? So it's a thing.
I was wondering, Jennifer, if you could speak a little to your partnerships with university entities, and in what ways have you collaborated with them? I know that there's work that's being done in the medical respite through the Purdue's nursing the Department of Nursing, and I know also there's been health education, especially during COVID, and it has that's continued, and so I was wondering if you can speak a little bit to that, because some of the strengths here, of course, in for us, right, is how can we leverage our strengths,
Yeah.
strengths in research, our strengths in evaluation, our strengths in grant writing. How
Yes.
can we leverage these to support the efforts of you and your
Yes.
partners?
Absolutely. And so you bring up a good point. And I did mention that housing is healthcare. And so really the public health space over at Purdue has been a huge, huge resource to us. Dr. Natalia Rodriguez, like she jumped in early on in COVID, and with her, honestly, with Purdue University Public Health and the student nurses and the Tippecanoe County Health Department, we all were, I would say, family. Like we became family. It wasn't just in survival mode, but they helped us navigate a horrible pandemic. Because I'm the housing people. Like I don't have all that. That's not my background, is not in healthcare. I just care about housing and human beings. But I do believe that when people don't have housing, because I see what happens when they don't have housing, that healthcare is just a critical piece to the work and to the people that we see. And so the dedicated collaborations that we have with Purdue University on just those lines are critical to the work. I mean, not just like they're nice to have, but it's critical to the work. So Purdue nursing students are here 3 times a week. They're doing healthcare assessments, health education, like really talking with people, providing resources, telling people where to go, how to get connected to care. Like it's just phenomenal. But then I've got another group that I'm working with. That's my call tomorrow morning. I've asked them to help me create, not help me. I don't want to create an app. I don't know how to create an app. I'm over 50. So I've asked them to create an app that people that are unhoused can utilize, that's got real-time links to it, so that people understand where to go and what time they need to check into services and what time they need to go to this food pantry. What day is this food pantry open? How do we make it easier for people? Because what happens is they're relying on bus transportation. And when people aren't open on the days that they thought, they literally have wasted resources trying to get their basic needs met. So working on an app. I've got another group from Purdue right now that's working on data collection. Again, data collecting is not my strength. I know how to read reports, but gosh, if really smart folks over at Purdue can kind of go through some of this data and pull out some information to help us do this work better, data is what drives decisions. Or it used to. Perhaps that's not the way with some federal funding anymore. I'm not sure what's happening there, but data is what we use to drive decisions. And so the more we can get, the better. So we're always looking for, how can people help us do this work? How can you lean in here and do this? So we have a communication committee. I have a development committee. We have a finance committee. A human resources committee. I mean, we've got all kinds of things for people with different types of expertise. I would challenge you all, come be part of a solution. Like if this is something that you think, gosh, I'm interested, like how can I be helpful? There is a way. And I have an engagement coordinator or myself, like where we can talk to you, find out who you are, what is your expertise, what is your skill set, what do you want to do? We have a facilities committee. So sometimes people come in and they'll paint an apartment. Help me get an apartment ready. Like if that's the barrier, get your group, come over, let's paint. Like it's a thing, and people can be part of this and help end homelessness for people. So there's things for everybody, even children. We've got children now that they're coloring lunch sacks. So come color lunch sacks. Bring your kids over. They can color lunch sacks while we're making peanut butter and jelly sandwiches for the weekend. Whatever. There's a place for everybody.
I was wondering if I can bounce off of Brianna's question. Brianna was asking, if you had all the money in the world, how would you handle homelessness? I actually wanted to also kind of build on your statement, which said, where you were talking about, here we have folks that are going into rapid rehousing program, but this isn't sustainable. So what do you think are some key factors or resources that are needed for individuals in organizations, whichever way you'd like to think about it, in terms of sustaining housing? So what are some key factors? Of course, having the market available is one, absolutely, but you were talking about a number of factors that influence people becoming or experiencing homelessness. So is there any kind of key factors or resources that we could kind of target to sustain housing once people have met that mark or reached that mark?
Absolutely. And one of the things that we are trying to really have concerted efforts behind is sort of going upstream. Can we prevent someone? Can we help them sustain that housing? Can we create an opportunity? There's several different organizations, churches, community groups that provide a prevention, like a financial assistance resources. And so how do we kind of bring all of them together? Because we make it really hard for people. And we need to make sure that they're worthy of the help. And so how do we just sort of create one pot of funding or one place that people can go? They don't have to go here and here and here. We try to make it real challenging for people. Let's cut all that. And how do we help people stay housed? How do we help keep people in their housing? Indiana is one of the highest eviction rates across the country because we are very landlord heavy, like in as far as friendliness. And so how do we create some tenant protections? How do we create some perhaps landlord mediation? Like, can we help tenants and landlords talk to each other instead of just filing an eviction when they're 3 days late on their rent? You know, could there be an opportunity to help people sustain their housing? Maybe teach people how to be housed, whatever the case may be. I think there are some opportunities. And then on the flip side of that, you know, before the end of January, I actually would have said to you, what we do right now is great, but we don't have enough resources in order to help all the people that need it. So while we have federal subsidized programs, to help those that are living in poverty, it's not to scale as to what we need it to be. So it's cute that we think, oh, well, we have all this low income housing. We don't have a lot of low income housing, not based on the number of low income people that need the housing. And so until we have the need that goes with the quantity, like we're way upside down already. Never mind if we reduce what we're already doing. So we just have not built to scale a system to help people that are low to moderate income. And until the system and the scale gets reset, we're going to continue to battle people that can't afford housing. Was that helpful?
Yes, very helpful. So sorry, I was looking for the chat to make sure I'm not missing any other questions or comments. And please, if there are any other questions or comments, please join in the conversation and share those with us. I just wanted to kind of loop us back over to the rural work that you're doing. It sounds like these challenges are growing. The fact that you initiated this with 30 as a household target, only to find yourself with 140 households. What do you think are some of the reasons why these counties are experiencing such an enormous growth of homelessness?
I'm not so sure that it's growth of homelessness, but now it's known. We didn't have a mechanism to connect people to services before. And so now once people sort of understood, like, oh, wait, what's going on? Wait, there's resources. There's people that can help. That then allowed people to sort of come forward to talk about their own housing crises or where they were staying. People in the rural communities, it does look different than urban homelessness. And so we have some folks that perhaps the adults can't sleep with their friends or family. They have to stay outside in the car in the driveway, and then the families will let their children sleep inside. Okay, well, that's interesting. These rural communities don't have emergency shelters, many of them. And so what we do find is that there are community or charitable organizations that, they might pay for temporary temporary hotel stays. And so if a family needs, they go to the Salvation Army or the United Way. And so they'll pay for 1 or 2 nights of a shelter in a hotel. So those are things that we can see. And so I'm not sure that it's increased. I mean, housing's expensive everywhere. Pay isn't going up the way it needs to. And so it's just much more known. Another one of the challenges that we've seen very critically, honestly, in the rural communities is that they don't have a very large pool of landlord opportunities. And what we've seen is if someone was evicted from a landlord in that community, not only do they have an eviction on their history, but if you were evicted from my brother Bob's place, I'm not going to have you come into my place. All the community members know each other. And so once you have an eviction on your history, most of the other landlords, they don't want you then either, because you've already done that to somebody else that they're working with. So really trying to overcome those types of barriers, communicating, mediating. These aren't my children. Like, I can't tell you, oh, they're never going to screw anything up, but I can say that they have support. And so we're here to walk with these tenants, help teach budgeting and the importance of paying rent. And we can be the come to Jesus meeting if we have to have a real critical conversation about housing and the need to prioritize it. So we do a lot of that in the rural communities. We do it here as well, but.
Excellent. Well, I think we're sadly and coming to an end of our time. And I just want to say that I really want to, on behalf of the Center of Migrant and Rural and Migrant Health, I want to thank you so much for this dive, very deep dive into the efforts that are being made to address homelessness, giving us insights into the barriers that persist and the alarming rise of homelessness in rural areas. And also just sharing with us these perspectives that are not in the literature, because work in these rural areas are not happening, not only in terms of organizations and practice-based or programmatic efforts, but also research. And so we have a lot that we need to learn. I want to thank you for your discussion today, and of course for your continued commitment to finding solutions, and your urge for all of us to keep these issues at the forefront, and for all of us to think about how we can work together and how we can leverage our strengths and our privileges to come to some solutions for these families, very vulnerable families. I don't see any further questions, but I do see that Jennifer provided everyone her email address, and I urge you all to do reach out. I have had the privilege of working with Jennifer, and I know that she, even though she's incredibly busy, does make the time to talk and have conversations and brainstorm. So if there is no further, again, I want to thank everybody for their time. I want to
Thank you so much for having me. Thank you so much for listening and caring about our unhoused neighbors. I appreciate your time.
I do have a question for you, Jennifer. Is it okay if we receive any, well, two things, a question and an ask. One is if we receive any emails or wants to connect, if we can reach out and do that with you and make sure that those folks are connected to you.
Of course.
And two, it's an ask that Susan had asked early in this conversation. But if there are any flyers or any events or any information that LTHC would like to get to as many partners as possible, we are happy to distribute that throughout our partnership network here. So if you could please share that information with us, we would be happy to send that as much as quick, as wide as we possibly can.
Appreciate you. I will get it to you. Thank you so much.
All right, everybody. Thank you so much for your time. Enjoy. I'm giving you back 4 minutes of your life. Enjoy them. Thank you, everybody.
Thanks, friends. Thank you.